Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. It's April the 20th. There was a long line outside the marijuana dispensary today. And this is another of our Facebook Live where we'll talk about COVID and not about marijuana. So some of you have already put in questions at Facebook questions at douglaspublichealthnetwork.org, and we'll get to those first. But then if you have questions, please put them into the chat section, and Vanessa will get them to me, and we'll try and answer as many questions as we can. As always, we usually start at the world view and then move down to the local view. Well, in the world, clearly in the fourth wave. So we had a big wave over the Christmas time and then fell at the end of January and February. But now, this last week is at the highest level ever. So although it was up and around Christmas, came down, it's up to the highest level ever. And so the world is now averaging over 700,000 cases a day. When we look at this, this is worrisome because it's very broadly based. It's not just one country that's having a lot of cases, but in South America, it's Brazil, Uruguay, and Argentina. And those countries have had cases for a long time. You remember, we're coming into our spring, but they're, being in the south, are getting into their fall. And so while we expect things to get worse in the fall, they've already had just a terrible, terrible time at a time when they should be having very little disease. In Europe, we're seeing a lot of disease in Turkey, Sweden, and Poland, but really pretty much all of Europe except for the UK are having troubles. And in Asia, we're starting to see some real hot spots now in Iran, Mongolia, and India. And so that is a big concern. In the US, we're slightly rising. You know, we were down in the 50s. We're now in the 60,000 cases a day. Hospitalizations are inching up. Deaths still stay low. But I think the U.S. is starting to see some increase in cases, and we're seeing them in places that will come as no surprise. We've been watching over the last few weeks. Michigan continues to have a lot of disease. Minnesota has a lot of disease, but we're also now starting to see some increase in disease in Texas. Now, it started in the Panhandle, and it's now moving to the rest of Texas. Florida started in the south of Florida and is now moving up. And then in the east, we've been seeing a lot of cases in New York and New Jersey, and now it's spreading through New England. And when you think of spreading through New England, well, all of New England is about the size of Oregon, so it doesn't take much for it to spread around. In Oregon, we're clearly seeing an uptick in the number of cases, and we're also seeing an increase in the number of hospitalizations. So although many of our seniors are vaccinated, these are now younger people who are in the hospital, and we're starting to see an increase in the total number of hospital beds being for COVID. I was on a call this morning with the hospital leaders in Portland, and they're not running out of physical space, but they're running out of people to run those spaces. You know, you can't just hire a guy and put him in the ICU. It really takes a tremendous amount of training to do that. And after a year of doing this, there's a lot of pandemic fatigue among those doctors and nurses who've been taking care of very sick patients for a year. And when we talk to them, they say it's just absolutely demoralizing to be taking care of people, many of whom die. And so while people like to work in the ICU for the excitement, the reason is that many of those people come in tragically ill after a car wreck or tragically ill after MI, and they recover, and most go home. Unfortunately, with COVID, many of the people who wind up getting intubated in the ICU do not go home, and they die there. So Oregon is starting to see this increase, and it's worrisome because Oregon has a pretty good immunization rate, and yet we're seeing an increased number of cases and an increased number of hospitalizations. This seems to be largely driven by spring break. You look at places where there are colleges in Oregon, and those are the places that are having the biggest increase in cases. I mean, Lane County a few weeks ago was about where Douglas County was, and now it's so much higher. Douglas County, doing well. We've had our best week in months. So if you've looked over the last few days, just a couple of cases a day, just 50 cases in the last week. So that's really one of our lowest weeks in a very long time. So that's good. We still have a number of people in the hospital though. And that really is a big concern. And We had another death this week from somebody who was hospitalized and died. So we're clearly not over this yet, although in Douglas County it's looking okay. But I will tell you, if you look at the world picture, it is not looking okay. And it's not looking okay mostly because of the presence of variants. And so it's something I follow all the time. And when you look to see that an area has some variants and then all of a sudden the B117 takes hold, and really within the space of just a few weeks that totally takes over. And this is what happened in England back around January, and they had their terrible time back in January. What's happening now in Sweden and Poland and Turkey, what's happening in Michigan and Minnesota. Now Brazil seems to be different because it's the P1 variant, which is another very worrisome variant. So it really seems to be a variant. And what I'm telling people now is this is a race between vaccination and variants. I mean, if we get enough people vaccinated, all of the vaccines seem to work pretty well against the variants. And so we'll be able to get the amount of disease down and just not have it spread. However, if we still have a lot of disease when the variants get here, the variants will spread very quickly, and that's a worrisome thing. For testing, we're still doing a lot of testing. There was a question about how much testing we're doing. We're doing a lot of testing, and our positivity rate is now less than 3%, which is considered to be very low. In addition, vaccine, there's a lot of vaccine going on. At this point, we've got a lot of vaccine, and what we're seeing is not much demand. So, for example, we have a big vaccine event this weekend, and it opened today, and we would expect with and now that everybody is eligible, that we'd have a lot of people wanting to get this vaccine, and the demand has not been high. So if you want to get a vaccine or know anybody who wants to get a vaccine, you can sign up anytime. It's going to be on the website. If you go on the website, we're using the Pfizer vaccine, an excellent vaccine. We'll give the first dose now and the second dose in 3 weeks. We have 900 open slots for new people and several hundred slots for people getting a second dose. So please, please, please go ahead and get your vaccine. Okay, let's get to our questions here. So I received a comment in email from someone who's fully vaccinated but is concerned about spreading the virus to others as part of a small outdoor gathering. So the story is, if you are vaccinated, not only are you very unlikely to get sick with this, but the new data suggests you're very unlikely to carry this. So this is not a disease that you carry asymptomatically for a long period. Even people who have asymptomatic infection, they're over in 10 days. So unlike other viruses or other bacteria that you could carry for a long time. So for example, there are people who have MRSA, which is methicillin-resistant Staph aureus, and they seem to carry it for weeks or months or years even, and it spreads around to people in the area. So some germs are like that, where you're a carrier. Hepatitis C, you can be a carrier of hepatitis C. Hepatitis B, this does not work that way. Either you have it or you don't, and you don't seem to carry it for a long period of time. So you do not need to worry about being a spreader of COVID. So the story is, what about going to a barbecue? I think a small outdoor gathering, outdoor gathering is pretty safe, and I think the recommendation is that if you're vaccinated, outdoor gatherings are probably fine. So Joyce says, how many Douglas County churches have had COVID spreading event in the past year? Well, we did a press release last week, and that'll give you the full number, but it's a dozen or so churches that have had a COVID spreading event. And some of these have been concerning because they've been big, with dozens or more cases. So what is considered an event when talking about churches? So in Oregon, you report an outbreak at certain different levels. So you report an outbreak at a nursing home with a single case. You report an outbreak at a business when you have 5 cases in a business of more than 30. We never report church outbreaks. And that was a decision that was made early on not to report church outbreaks. So we follow them, but they never get reported. And so people get the sense of, well, I haven't heard about any church outbreaks, so they must not be happening. That's not the case. These church outbreaks are happening, and they make up not a majority of our cases, but the majority of our cases are workplaces and households, but they make up a pretty good number of those, of the outbreaks, and some hospitalizations and deaths, so we do worry about it. So is congregational singing okay if everyone is wearing a mask? We do not know the answer to that. We know that singing is clearly related with spread of disease in churches and other kinds of places. We don't know. We don't know if congregational singing, still the recommendation is that we don't do singing. So both my husband and I are fully vaccinated, 2 doses in 14 days. Congratulations. We would like to go to the casino. What level of risk do you think that would be? Again, casinos pose some risk because there tend to be a lot of people in the casino, and they tend to be people from all different areas, so there's an exposure, and it is indoors. So to the negative, casinos, a lot of people, some crowding in indoors. To the good, however, you're vaccinated, and that reduces your risk quite a lot. And casinos, in general, have very good air handling because there are a lot of smokers, and they don't like the pall of smoke to be there. So casinos tend to have very good air handling. So putting it there, it's not a super high-risk event because you're vaccinated and there's good air handling, but it's still a moderately high-risk event. And so it's a moderate risk event. And you remember, I'll never say that something is totally safe or totally unsafe. I think that's unfair because there's almost nothing in life which is totally safe or totally unsafe. This is kind of in the middle. To the good, you're vaccinated. To the good, there's good air handling. But to the bad, there's a lot of people there. And if somebody were sick, it would be so hard to trace who was there and who got you sick. So that's what I'd say. So Nancy says, where do I sign up for the vaccine clinic this weekend? There's 2 ways to do it. One is you can call on the phone, and it takes just a few minutes, leave a voice message, and somebody from DPHN will get back to you and schedule you. Or I always try these things out, and I tried it out today. It took me 1 minute and 8 seconds to sign up for a spot today. So you go on, we're using Eventbrite, and there's an Eventbrite link, which you can find on our website. You just get on there, click it, answer a few questions, and you got a vaccine appointment. There are plenty of appointments, I think, already for this weekend. So please, 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 please sign up. So there was a question about they're taking hydroxychloroquine, and the question is, does hydroxychloroquine prevent me from catching COVID? And you'll remember back last year, there was a lot of talk about whether hydroxychloroquine works. Some people call it a miracle drug, and there's been a lot of controversy. I think there have been a number of studies about taking hydroxychloroquine once you're diagnosed with the disease to show whether it prevents you from getting sick or whatever else. There, however, were people taking hydroxychloroquine for other things. They were taking hydroxychloroquine for lupus or for arthritis, and so now there's studies that look at these people. They got COVID at exactly the rate you would have expected. So the hydroxychloroquine, while they may have helped them with their lupus or their arthritis, it didn't seem to prevent them from getting COVID. That is unfortunate. So somebody says, I read today about a new Texas variant, but info was sparse. What can you tell us about this new variant? Well, I can't tell you that much more. It's called the BV1, Brazos Valley 1. Which is a variant which apparently is a new variant that's out there that contains some of the mutations that are there in the past. So when mutations happen, they accumulate. So I'm not sure this is a great analogy, but it's the best one I've heard. So imagine that you had a recipe and you had to copy this recipe by hand and hand it to 5 different people. Those people would try the recipe. If they liked the recipe, they then should spread it to 5 more people, and then on and on and on. So imagine the recipe, and actually the genetic code of this is about the same length as a long recipe. And so imagine if you were writing out this recipe, you might spell, and let's say it was a recipe for cupcakes, you might spell one of the words wrong. Like you might put 1 L in vanilla, or you might spell flour, mixing up the U and the O. As you copied that, it is unlikely that would make any difference, and the next person would do it, and they would probably just copy your mistake all along, and it probably wouldn't make a big difference. So many of the mutations we have are nonsense mutations. Some of the mutations would actually make your cupcake recipe worse. So instead of writing 1 teaspoon of vanilla, if you wrote 1 teaspoon of Tabasco, and people made this and it had a teaspoon of Tabasco. Oh my God, those are disgusting. And this wouldn't spread any further. But you might, instead of having a teaspoon of vanilla, put a tablespoon of vanilla in it and decide, these taste better. And then people would spread this more and more. Now, if you spread it with a tablespoon of vanilla and then later on somebody added a quart of rum to it and that even made it taste better, what you could see is that these mutations would accumulate. And that's our concern, is they would accumulate. So we think the BV1 is one that took previous mutations and put new ones in it. And that is the biggest fear of the variants. If I could promise that the variants would stop where they are now, where the B117, we could get past that, because the B117, although it's more contagious, seems to be fairly well controlled by the vaccines. And so we wouldn't worry too much about it. The concern is if you start with the B117 and then add to it like the 484E, then that would make it more contagious and less amenable to the vaccine, and that would be a big concern. And again, we'll have to see about this BV1. As you remember, for the last 3 weeks, we've been talking about a funny outbreak in the Texas Panhandle. Not really an area we usually think much about, but that's going to be a problem. So, do we know why older people are more susceptible to COVID and have more severe symptoms versus younger people? KCS. That has been a great question, and that will be one of the great questions of the year. They actually do not appear to be more susceptible to infection. They seem to be about equally susceptible to infection, and we've seen this when we've looked at cruise ships where you know what the denominator is. What happens is that when they get sicker, and so asymptomatic cases are more likely to get recorded. If you're a young, healthy 23-year-old, you might have the symptoms of COVID. Say, it's nothing, I'm not even going to go to the doctor. If you get to be 70 and you have the symptoms, you probably do. So we think there's about even susceptibility, but it's very clear that your chance of getting sick enough to be hospitalized or dying is so very different. So there's a very nice piece from the CDC that looks at the risk of hospitalization and death at the different ages, and it's thousands of times different between somebody who's 20 and somebody who's 80. Do we know why the reason there is? And we don't know the reason. There's all kinds of theories as to what's going on, and nobody knows. The Bob Dannenhoffer theory, and this is me alone, is that I think that when you look at the bad effects of COVID, it mostly affects the vascular system, so the blood vessel system. Even though you don't have a lot of virus in the bloodstream, it does seem to affect the vascular system in a bunch of ways. In the lungs, what happens is that it makes it so that the blood doesn't get to the area where there's air, and air gets to area where there's not blood. And that's why I have these very low oxygen levels. It seems to affect the blood vessels in many ways by causing clotting, and it seems to cause other kinds of issues in blood vessels. One of the most remarkable changes with age is the smoothness of your vascular system. If you've ever, sadly, done autopsies on different age people, you'll look at kids, and their blood vessels are super smooth. I mean, they're just as smooth as baby skin. They're just super smooth. They have almost no divots, no potholes. They look great. And as we get older, we begin to get little divots in our blood vessels. So if you look at the blood vessel of an 80-year-old, it looks like a pothole road. There's all kinds of stuff in it. And so this really does seem to correlate with the smoothness of your intima. So that would be my theory as to why as we get older, because other things that damage your intima, diabetes, hypertension, all our obesity, are all real risk factors for COVID. So someday we'll figure it out why older people get so much sicker than younger people, but for right now we don't know. Older people do tend to get sicker with other things. We tend to get more cancer as we get older. We tend to get other things, but not at an 8,000-fold difference between them. So Robin says, is there an acceptable method for determining air circulation in an indoor area such as an uninsulated warehouse? So, yes, there is. And this is air changes per hour, or ACH. So imagine a room like the room I'm in now, which is maybe 15 by 20 and 10 feet tall ceilings. So there's about 3,000 cubic feet. Now let's say we had an air changer here that did 1,000 cubic feet per hour. There would then be 3 air changes per hour, which is pretty good. So if you look at air changes per hour, less than 2, not very good, 2 to 5, kind of borderline, more than 5, good, more than 15, great. Airlines actually have over 10, and that's why we've not seen a lot of spread on aircraft, which is very interesting, right? Because on an aircraft, you're seated right next to other people for a long period of time, so you'd expect there would be a lot of transfer on airplanes. Doesn't seem to be, probably because there's good airflow. ORs, 10 or 15 air changes per hour, almost no spread in those kinds of areas. Start getting down to a poorly ventilated place, an older place, that would be bad. So air changes per hour, there's a way to calculate it, and so there's a whole group out there now who's looking at improving ventilation by looking at air changes per hour, and that's good. So places that are newly built tend to have not much leakage. They don't, the windows fit well and the doors fit well, so there's not a lot of leakage, and so they then need to have very good air handling systems so they can deal with that. So it's air changes per hour, less than 2, not so good, 2 to 5, kind of borderline, 5 to 10, good, more than 10, really excellent. Yeah, so if we're going to get this vaccine every year like the flu shot, do we need to stay with the original vaccine we got? So if I got J&J this year, can I get Pfizer the next? We do not know that. I would think biologically there would be no reason not to get either the same or a different one. So I don't know. We don't even know if you're going to need a booster. I think at this point it is not unlikely that you would. Okay, let's go through a few other things here. One of the things, if you've been looking at the OHA site, and I look at it every day, is when you look at the vaccine rates in Douglas County, we look not very good. So we look lower than all the counties around us, and we look one of the lower ones in the state. Now, anybody who's been watching this for a while recognizes there's a data problem, and the data problem is Douglas County is the only county in the state that has a significant portion of its vaccine given by the VA and by a federally recognized tribe that reports to the CDC. So we know that the Cow Creek has given over 4,000 vaccines, the VA is over 7,000 vaccines that don't get counted in the Oregon data. So I was finally able to get only summary data for the different counties, and it turns out that if you look at the CDC data, Douglas County is 24%, which is just below Lane at 25, but ahead of the counties around us, Goose Curry, Josephine Jackson, around us. And the difference in the way the CDC counts it, the state counts it, is about 4,200 individuals, almost exactly the number we would have predicted by looking at the Cow Creek and the VA numbers. And so it's maddening for me to look at this every day and feel like I'm one of the worst performers here when I know we've done a great job. So if you put it there, we're actually right in the middle of the pack. There's only 3 counties in Oregon for whom this makes a significant difference. So I was able to count the CDC rate and the state rate for all of the other counties in the state, and only Multnomah County, where there's a VA that gives some vaccines, Hood River County, and I don't know why there are differences, and Douglas County are the 3 counties where we're off by more than 1%. And so when you look at that number, and I've gotten a lot of grief, why is Douglas County so low? That's at least one of the reasons why Douglas County is so low. And the other concern is that we have a number of people who don't want the vaccine, and that is an issue. All right, one of the other questions that comes up is about vaccine deserts. So the state presented some data today, and they looked at the state overall, and then they looked at census tracts. So census tracts are areas, typically about 10,000 people or so in an area, and they look to see, and they're classified as rural or urban and whatever else. So Douglas County has a dozen or so census tracts, and they look to see, are there vaccines in every census tract, and can most of the people get to a vaccine in 5 minutes if you're in an urban area, and in 30 minutes if you're in a rural area. And so they looked at vaccine deserts around. And it's not surprising that in eastern Oregon there are some vaccine deserts because there's not very many people in those areas. But what you did see is that even in some of the urban areas, Multnomah County, Lane County, that there are areas that are really not very much vaccine and a lot of people. So they had these bright pink vaccine deserts. Turns out Douglas County is one of the few counties that had no vaccine deserts. And that's because we've tried really early on to get vaccine around. So we've gotten vaccine to providers around, and the Tiger team was out today giving vaccine. And so they're going to be down south. They're going to be out in Camas, Looking Glass, Toketee, all of those areas trying to get vaccine as best we can to as many people as we can. Okay, there was another question in here about one of these vaccines who are now approved under emergency use authorization going to get full approval. So I looked a little bit more about that this week. So emergency use authorization allows things to get approved using minimal data. So in the military, this happens not infrequently, that there's some problem and they approve a vaccine or something under emergency use authorization for that kind of thing. With the vaccines, they approve these vaccines under emergency use authorization, but when they approve them, they require the level of data that they would have approved for final approval. So the difference between the EUA for these vaccines and final approval is fairly small, but it's not clear if or when these areas are going to get full approval, but it's no reason not to get the vaccine. Really, these vaccines have been very, very, very extensively studied, and I think you can be very comfortable that these vaccines are going to work. We'll get to the J&J question in just a little bit. Another question here is somebody they knew broke their hip, they were in the hospital, when can they get the vaccine? You can get it in the hospital, you can get it on discharge from the hospital, so there's no reason to delay getting the vaccine after any other medical procedure. So again, no contraindication. So no matter who you are or what you are, it's better to get the vaccine than not get the vaccine. So let's talk about the J&J. So the J&J vaccine, so we'll go back 10 days ago. A few anecdotal reports about blood clots associated with the J&J vaccine. Last Tuesday, so just 1 week ago, the CDC put a pause on it. And I got a chance to hear a long 1 hour conversation with Stephen Marks from the FDA. And there are really two reasons they did that. One was to look to see if there were other cases other side effects like this that might have not gotten reported. And by reporting the very specific side effect that they were looking for, low platelets and clotting in unusual areas, they were going to make people aware of this, so you could say, yeah, I was in the hospital last week and there was somebody who had that, and so that these would give a week or so for these to get reported. The good news is they've only reported another couple since that time, and so the good news is the rate appears to be very low. The other reason they did this is because the treatment for this clotting and low platelets is to avoid heparin, which is normally what you would give when somebody had clotting, is you'd give heparin, and in this case, it just makes the clotting problems worse. So you're not supposed to give heparin, and they wanted to let people know so that if you saw this, they wouldn't fall in the trap of reaching for the heparin. They would instead use one of the other anticoagulants that are out there. And so now they've had a week or so to look at this, just a few more cases, and I think they're going to meet again later this week, and they'll make a decision. My guess is that they'll make a decision to allow the use of J&J, perhaps with either more warnings or maybe with some age restrictions, but I think J&J is going to be back on the shelf, which is a good thing because we have a lot of demand for the J&J. It's so much easier to use as a one-dose vaccine, so much easier to store, that I think we're going to be able to use that again. All right. Let's work on some questions. It would be really great to be done in half an hour. This would be great. So one of the other questions that came up was about kids 12 to 15. I still have not seen the date that the ACIP is going to be considering kids 12 to 15 for the Pfizer vaccine. And so I do not know when that's going to get approved. So typically what would happen would be that the FDA and ACIP then would look at this, and then within a few days, they would expand the indications to people 12 to 15. Right now, it's just going to be people 16 and above. So again, we've got a lot of vaccine out there. Almost all the pharmacies have vaccine. All the clinics have vaccine. And we're going to do this big event this Saturday at the Fairgrounds. It's going to be all Pfizer vaccine because the J&J is still on hold. It's going to be all Pfizer vaccine. We're going to be doing first doses and second doses. Very easy to sign up. If you look on the website, you can sign up on Eventbrite, which just takes a minute or two, or you can call and the lovely people from DPHN will go ahead and get you an appointment. We have, for Spanish speakers, we have a Spanish speaking line, and we're really, really trying to get people out there to get the vaccine. Because I think, as I said, I think we're at a crossroads now. I think if people can just hang with us a little bit longer, get a lot of people get vaccinated, we can stay at 2 or 3 cases a day, in which case, at 2 or 3 cases a day, you could get rid of the masking, you could get rid of almost all the restrictions. You could go back to 2018. I mean, you could really do a lot more stuff if you only had 2 or 3 cases a day. And that's why we're hoping people will do it. The concern that I have is that it would be like Michigan. So there's no reason that Michigan is so bad and Oregon isn't. We have similar amounts of underlying vaccines, similar amounts of previous history with this. And so the concern is that if not enough people are vaccinated, we'll sort of grow complacent when we have a low number of cases. It'll get introduced in the community some way, and it could get introduced by a ball club coming from somewhere else, a group of visitors coming from somewhere else and then it'll spread in Oregon. And when it spreads in Oregon, it's likely to spread just like it did in Minnesota and Michigan. It spread very quickly, where instead of just having a few cases a day, we could be back to 30 cases a day. And with those 30 cases a day, we will see hospitalizations. Now, we'll see fewer because, again, most of the seniors are vaccinated and the vaccine has been very effective, but not 100% effective. And we still have probably half of the people, 55 to 65, who are not vaccinated, and they get sick. Now, we've not had any deaths in people under 60, but starting at age 60, we've seen quite a few deaths. And what will happen is this disease will continue to pick people off, and that would be a real concern. I really want to be done with this. I would love to be done with Facebook Live. I would love to be done with all of this and then get back to some of the other important public health work that we've put sort of to the side for the last year. And so I'd love to get back to that. But what I worry about is that if we don't get enough people vaccinated, we're leaving ourselves open to have another surge of disease. Okay, they said that's all the questions. That's great with me. Again, Dr. Bob Dannenhoffer, Public Health Officer of Douglas County. Be safe, be kind. We'll do this again on Friday. And my fondest hope is that as the summer goes on, more and more of us get vaccinated and we see less and less disease. And then maybe we can talk about something else or maybe not meet at all. Again, thank you.